Diabetes is a condition that affects how your body uses food for energy. Think of your body as a car and food as the fuel. Normally, when you eat, your body turns the food into a type of sugar called glucose. This glucose travels through your blood, and a special hormone called insulin acts like a key. This key unlocks your body's cells, letting the glucose in to be used for energy. This process gives you the power to walk, think, and do everything you need to do throughout the day. It is a wonderfully simple and efficient system that keeps our bodies running smoothly, but sometimes this system can run into problems. In people with diabetes, this key and lock system does not work as it should. There are two main types of diabetes, each with its own cause. In type 1 diabetes, the body's own immune system mistakenly attacks and destroys the cells in the pancreas that make insulin. This means the body has no key at all, so glucose cannot get into the cells and instead builds up in the blood. This type often starts in childhood or young adulthood. It is not caused by lifestyle choices, but by an autoimmune reaction that we are still working to fully understand. It is a lifelong condition that requires careful management from the moment it is diagnosed. Type 2 diabetes is much more common and works a bit differently. In this case, your body either does not make enough insulin or the cells become resistant to it. It is like the locks on your cells have become rusty, and the insulin key has a hard time opening them. This insulin resistance means glucose struggles to get inside the cells, causing high blood sugar levels. A number of factors increase the risk of developing type 2 diabetes. These include things like being overweight, not being physically active, and having a family history of the condition. Our modern lifestyles have, unfortunately, made this type of diabetes increasingly prevalent across all age groups. The causes of these two types are quite distinct. For type 1, the primary cause is an autoimmune response where the body's own defenses turn against itself. Genetics can play a role, making some people more susceptible than others, but it is not directly inherited in a simple way. For type 2, the causes are often a complex mix of genetics and lifestyle. Things like a diet high in processed foods, sugar, and unhealthy fats, combined with a lack of regular movement, can significantly increase your risk. It is important to remember that this is not about blame, but about understanding the factors that contribute to our health so we can make positive changes. Your body often sends out signals when something is not quite right, and diabetes is no exception. One of the most common early signs is feeling thirsty all the time, no matter how much you drink. This happens because the excess sugar in your blood pulls fluid from your tissues, making you dehydrated. As a result, you might also find yourself needing to go to the toilet to urinate much more frequently than usual, especially during the night. These two signs often go hand in hand and are your body's way of trying to flush out the extra sugar. It is a clear message that you should not ignore. Another key sign is feeling constantly tired or fatigued. When glucose cannot get into your cells to be used for energy, your body is essentially being starved of its main fuel source. This can leave you feeling drained and lacking the energy to do your normal daily activities, even after a full night's sleep. You might also experience unexplained weight loss. This can happen even if you are eating more than usual. Without enough insulin to help your body use glucose, your body starts breaking down muscle and fat for energy instead, which leads to a drop in weight. This is a significant sign that your body is not getting the fuel it needs. Changes in your vision can also be a warning sign. High blood sugar levels can affect the small blood vessels in your eyes, causing the lenses to swell. This can lead to blurry vision that may come and go. You might find it difficult to focus on objects, or notice that your eyesight just isn't as sharp as it used to be. Furthermore, you might notice that cuts, sores, or bruises are taking a very long time to heal. High blood sugar can damage your nerves and affect your circulation, which impairs your body's natural ability to repair itself. Even small injuries can become problematic if they do not heal properly. Finally, some people experience tingling, pain, or numbness in their hands or feet. This is a sign of nerve damage, known as neuropathy, which can be caused by prolonged high blood sugar levels. You might also be more prone to infections, such as skin infections, gum disease, or yeast infections. This is because high sugar levels create a more favorable environment for bacteria and fungi to grow, while also weakening your immune system's response. It is vital to pay attention to these clues. Recognizing them early can make a huge difference in getting a diagnosis and starting to manage the condition before it causes more serious problems. When diabetes is not managed well, the high levels of sugar in the blood can act like a slow-acting poison, causing damage throughout your body over time. One of the most significant impacts is on your heart and blood vessels. High blood sugar can damage the inner lining of your arteries, making them harder and narrower. This condition, known as atherosclerosis, significantly increases your risk of having a heart attack or a stroke. It also contributes to high blood pressure, putting even more strain on your entire cardiovascular system. Taking care of your blood sugar is, therefore, directly linked to taking care of your heart. Your kidneys are also at high risk. These incredible organs act as your body's filter system, cleaning waste products from your blood. They are filled with millions of tiny blood vessels that do this filtering work. Persistently high blood sugar levels can damage these delicate vessels, making the kidneys less efficient. Over many years, this can lead to chronic kidney disease and, in severe cases, kidney failure. When this happens, a person may need dialysis or a kidney transplant to survive. Protecting your kidneys is one of the most important long-term goals of good diabetes management, highlighting how interconnected our body systems truly are. As mentioned earlier, your nerves are also very vulnerable to the effects of high blood sugar. This nerve damage, or neuropathy, often starts in the feet and hands. It can cause a range of sensations from tingling and numbness to burning pain. If you lose feeling in your feet, you might not notice a small cut or blister. Because diabetes also impairs healing, this small injury could become a serious infection or an ulcer that is very difficult to treat. In the most serious cases, this can lead to amputation. This is why daily foot checks are so crucial for anyone living with diabetes. It is a simple habit that can prevent devastating consequences. Finally, your eyes are not immune to the damage. Diabetes is a leading cause of blindness in working-age adults. The condition that causes this is called diabetic retinopathy. It occurs when high blood sugar damages the tiny blood vessels in the retina, the light-sensitive part at the back of your eye. Over time, these vessels can leak, swell, or even close off completely, which can distort your vision. In the later stages, new abnormal blood vessels can grow, leading to serious vision loss or blindness. Regular eye screenings are essential to catch any changes early and receive treatment that can help protect your precious sense of sight. The good news is that for type 2 diabetes, prevention is powerfully effective, and it often comes down to simple, sustainable lifestyle changes. You do not need to run a marathon or follow an extreme diet. It starts with small steps. One of the most impactful things you can do is to increase your daily movement. Aim for about 30 minutes of moderate activity, like a brisk walk, most days of the week. This helps your body use insulin more effectively and can help you maintain a healthy weight. It is about finding an activity you enjoy, so it becomes a natural part of your routine rather than a chore. Your diet plays an equally important role. Focus on eating whole, unprocessed foods. Fill your plate with colorful vegetables, lean proteins like chicken or fish, and healthy fats from sources like avocados and nuts. It is wise to reduce your intake of sugary drinks, sweets, and foods made with refined white flour. Choosing high-fiber carbohydrates, such as whole grains, beans, and lentils, can help keep your blood sugar levels more stable. It is not about deprivation, but about nourishing your body with the right kind of fuel. Making these small swaps can have a profound effect on your long-term health and well-being. If you are diagnosed with diabetes, it is not the end of the world. It is a manageable condition, and with the right approach, you can live a long and healthy life. Management often involves a combination of lifestyle changes, regular blood sugar monitoring, and sometimes medication. Monitoring your blood sugar at home helps you understand how different foods, activities, and stresses affect your body. This knowledge empowers you to make informed decisions day by day. Your doctor might also prescribe medication, such as metformin for type 2, or insulin injections for type 1, and some cases of type 2, to help keep your blood sugar in a healthy range. Living with diabetes is a journey, not a destination. It is important to build a strong support system around you, including your doctor, a dietitian, and your family and friends. There will be good days and challenging days, and that is perfectly normal. The key is to stay positive and focus on the small, consistent actions you can take every day. By taking control of your health through diet, exercise, and proper medical care, you are not just managing diabetes. You are investing in a healthier, more vibrant future. You have the power to influence your health, and every positive choice you make is a step in the right direction.